Ovarian cysts are growths in the ovary. So the eggs in the ovary sometimes overgrow and they have growths and they contain fluid inside. And we have different type of cysts. So karibuni sana, happy 2025. My name is Dr. Karanja Mwangi and I'm happy to be here again to continue with our series of videos and health education about the reproductive system and generally about our gynecological condition. Today we are going to do something different a bit. We've been doing videos throughout. Now we want to take questions from specific clients, from random women. So we asked questions and we sampled some of the questions that they asked, and we are going to hopefully answer all of them. So I'll go through a few of the questions, actually all of them. And the first question we got from an anonymous client is talk about the different cysts. Can they be cancerous? And if not, what will make one know that it's safe? I think here she meant ovarian cysts. Now, ovarian cysts are growths in the ovary. So the eggs in the ovary sometimes overgrow and they have growths and they contain fluid inside. And we have different type of cysts. There are those we call benign cysts and there are those we call malignant cysts. So these are medical terms just to mean malignant is a cyst that is cancerous and benign is a cyst that will not turn into cancer. And there are different ways of treating each of them. You can also divide the cysts into the sizes. There are those which are small and you don't have to take any action, you don't have to treat them. And there are cysts which are large that will cause symptoms, either pressure symptoms or pain or discomfort. Those are large symptoms, cysts that might require for them to be removed. And there are different other way of classifying the cysts, and that is more of medical. We have functional cysts, we have endometriotic cysts, we have simple cysts, we have what we call dermoid cysts. But the main differentiation that you should know is that we have cysts that can be cancerous and we have cysts that are benign. So see your doctor and they will be able to differentiate what kind of cyst that you have. Next question was, I have a cyst in the right breast and it usually pains when cold. Last week I traveled to Germany and I felt a lot of pain in the area coming to my chest, only to be taken to hospital and realize that it burst. What will lead to this and what are the risks involved? A minor surgery was done to clean the fluid and I was given some medication. From there, should I be concerned? Now, these are, we need to differentiate breast cysts and ovarian cysts. So from what the question is asking and the symptoms, the way she presented, this one sounds like infection of the breast, what we call a breast abscess, which usually comes from infection of the breast, which is mastitis. Then you have the pus forms in the breast. And it's very common when someone is breastfeeding, but it can also occur in other scenarios where you are not breastfeeding, either your immune system is low or immunosuppressed. So it's an infection in the breast. And just like any pus that you can have, like what we usually call a jeep, you have to incise it and drain the pus out, and you're given antibiotics and you'll be good to go. The next question here is about menopause. Can you talk about menopause in women, about the menstrual cycle and the hormonal pills, and why do Africans not take the hormone pills as much as the Americans? I think she meant hormone therapy. We just can't survive without hormonal therapy. So for you to understand menopause, you must understand the menstrual cycle. So the menstrual cycle happens when you're in the reproductive age group, usually above 13 up to around 49 years, some even earlier, 45 years. So the menstrual cycle starts from the first day you have your period until the last day before your next period. So if you say the cycle for this time is day 1 when you have your periods, then if tomorrow you have your next cycle, so today is the last day of this cycle. And we usually divide it into different phases. We have the follicular phase, that is the phase from the time the period starts until the time you ovulate. Then we have what we call the ovulatory phase, that is when you're ovulating. Then we have the luteal phase. Luteal phase is after you ovulate until the time now you get your next period. And each of these phases is very important in terms of conceiving, but that one we'll discuss it in a different video. Now, in terms of menopause, can you talk about menopause? Menopause literally means it's menopause. The menses have paused, but they have paused permanently. So this is when your menstrual flow, your menstrual cycle stops completely. And it's usually a transition. It doesn't just stop immediately. So when you reach around average 45 to 49 years, but for some people it comes earlier, for some it comes late. And it's usually a transition. It starts with you get lighter menses, and the period of not having your periods also increases. Let's say if you're getting your period every 1 month, then you start getting your period after every 2 months, then after every 3 months, then after 6 months, then it stops completely. It usually happens because of the hormonal changes that are initiated by the changes that occur in the ovary, the changes that occur in the brain. And the main hormone that is affected is the estrogen hormone, is the one that is produced by the ovary. So when the estrogen hormones go down, you don't get your periods. And this leads to many changes in the body. Actually, menopause and the hormonal changes affect your whole body, all the way from the hair to the head to the brain, the chest, the abdomen, the reproductive system. Of course, all of us know what happens to the reproductive system, the urinary system, your skin, your emotions. But the main ones that we deal with for the reproductive part is your period stop. Then there's what you call the hot flashes. Hot flashes are you feel very hot and you sweat. Most of the time it's just half of the body from this point coming up. And it can happen in the evening or even at night. Everyone is feeling cold, but you're feeling very hot, sweating. The fan is not helping. But after some time, it just clears and you go back to normal. That's what you call hot flashes. We have emotional changes or emotional ability, where you have mood swings. In the morning, you're good to go. In the afternoon, you're feeling moody. You don't want to talk to anyone. And there's no main reason that you can explain why you're moody. There's also increased risk of infection, because estrogen helps in the lubrication and the flora of the vaginal area, that is the birth canal. So if the hormones are reduced, you also have a risk of increased infection and also vaginal dryness. You know, there's importance of having that normal discharge and lubrication. And there are many other symptoms which we will need a whole like 30 minutes to discuss about menopause. But just to answer this part of the hormonal therapy, why do Americans use the hormone therapy liberally than Africans? Okay, now in our setup, it's like it's become normal to say that you're in menopause. Those symptoms are, expect that ni hormones zimekuwa hivyo. So it's become normal. Even if you go to some doctors, they'll tell you itabidi uzoee. But hormone therapy is a necessity. You need to live a normal life even if you're in menopause. So I'll not go into the detail of the hormones, specifically what you use, but you need to visit your gynecologist so that you discuss the pros and cons of using the hormones, because not everyone is eligible to use the hormones. The other question I think is related to the same. Also, what happened to the whole female system besides not just getting your menstrual? What also happens? Some people say their system just shuts down. I think that I've explained. It's like your system shuts down, but there's help if you seek medical counsel. Another question here, quite interesting. Talk about vaginal farting. Is it normal? And when should one be concerned, especially after giving birth naturally? Vaginal flatulence, or what some people call queefing or farting, most of the time is actually normal, and it happens during intercourse. It can happen in pregnancy. It can happen when you exercise. It can happen. It's normal. But if it becomes frequent, like every day it happens, or for this case, after giving birth, it could be that your perineal muscles or the muscles of the pelvis were affected during childbirth, or maybe you had a tear, or what we call an episiotomy. That is when during delivery, there is the place that the doctor or the nurse will cut so that the baby can pass out, the baby can be delivered smoothly. So that stitching, the cutting and the stitching can cause trauma. So you need to go back to your doctor so that they can examine you and see if there is any communication between the anal region and the birth canal, or if there's a defect in the wall of the birth canal, because that could explain why you're having the vaginal farting after childbirth. Talk about IVF and how it works, the risks involved. This is another whole topic, but I'll try to cut it short in a minute or two. IVF in full means in vitro fertilization. It's just conception that happens outside the natural womb, the natural way of conceiving. So what happens, you take the egg of the man and you take the egg of a woman, that is the ova, and the sperms, and you fertilize them in the laboratory outside the womb. So when you form now the embryo, you transfer the same embryo back into the uterus so that it can grow and become a normal pregnancy. And this usually happens in couples who are infertile. They've tried to conceive for some time and it's not possible. That's the most common reason why IVF is done. Or you can just decide to go and do IVF. You're single and you want a child, you can do IVF. There are many risks involved, but of course there is the advantage of you getting a child, but it was not possible to do it the natural way. So with that, I think the risks that comes with it, that is a whole topic we'll have to discuss about the risks, because if I mention each and every one of them, but the most one is of course the cost. It's very expensive to do IVF, and also there are some hormonal drugs that you're given and there are side effects of those hormones. The success rate for IVF, it's usually less than 50%, sometimes less than 40% success rate. So you can imagine using 400,000 and success rate is 40%. So you need to have that discussion with your fertility specialist on how effective is it, what is the success rate. Also, after the embryo has been implanted into the uterus, there's a risk of miscarriage. So you'll be put on drugs to try and maintain that pregnancy until 9 months. Okay. Another question here. Talk about the natural birth control ways for one who will not want to use any control pills. I think here you're talking about family planning or contraception. Family planning, the natural way. First of all, before we go into the details, is it's good you have a normal, regular menstrual cycle. So your period is either 28 days, either 30 days, 26 days, 24 days, so that you can predict when you are ovulating. These days we have many apps. You can download an app in your smartphone that can monitor your cycle. So it will show you when most probably you're ovulating. So that time that is predicted when you're ovulating or when you're ovulating, a few days before, 2 to 3 days before the day of the ovulation, and a few days out, 1 or 2 days after, those are the days you are at risk of conceiving. So at that time, you try and abstain. You should not be intimate. You should not have sexual intercourse because you're going to conceive. But these other days, you can have unprotected intercourse because you will not conceive. But history has shown that people have conceived even the days that we call the safe days. There are people who've conceived, and sometimes we can't explain why. It's mainly because of the differences in the cycles. This cycle, you might have a 28-day cycle. Next cycle, it comes 20 days, so it means you ovulated earlier and you thought maybe you timed it well. So the natural method is good because you're not using any hormonal therapy, but it's one of the most ineffective because of one discipline. By discipline, I mean not having sex during that period you're supposed not to have. Because when you're ovulating is when the libido of the woman is at almost the highest level. So you can imagine that's when you have the urge to have sex and you're being told not to have. Number 2, using protection during that period is also another issue. You're married, you've been staying with your person for the many years, then now you want to use protection. Some people don't take it well, so you have to use the natural way, meaning you abstain during that time. And at any point you miss the dates, there's a risk of getting pregnant. Another question here. What is fallopian tube blockage? Okay, the fallopian tube, as you all remember your primary, secondary biology, the reproductive system, you have the uterus, of course, that is the womb. Then you have the fallopian tube on the sides, and that is the site where fertilization occurs. So if the tubes are blocked, let's assume this is the right tube and it's blocked there. When the sperms come from the cervix to the womb into the fallopian tube, they cannot be able to meet the egg, which is the ova, because the tube is blocked. So you can't conceive when your tubes are blocked. That is if they're blocked on both sides, because sometimes you can have blockage on one side and sometimes that side can be patent and you'll be able to get pregnant. Most of the time we don't know the cause, but the commonest cause is infection. Maybe you've had a surgery before. That's number 2. There's what you call adhesions that can cause the tubes to block. Endometriosis also can cause tubal blockage. Growths like fibroid can also cause tube blockage. So you need to consult your doctor and try and see the cause of the blockage and see if it can it be opened, or is there a drug you can be given like treating infection so that the tubes can open. Is it true that a woman with sickle cell would lose their life if they were to give birth? The direct answer is no. Personally, I have managed and delivered many women who have sickle cell disease, and we've gone up to 9 months, some 8 months, they have delivered normal, mother is okay, baby is stable. The most important thing is when you're being followed up as when you have sickle cell disease, it's good to know when you're planning to conceive, when you're planning to get pregnant. Talk to your doctor, go see a gynecologist together with the doctor who is following up for the sickle cell disease. We discuss so that there are some drugs you'll have to either reduce the dose or stop. Then when you conceive, we discuss the changes that might occur, the risks, and how they are going to be managed. But majority of women with sickle cell, they get pregnant until delivery. So they don't lose their life, not unless there are complications that either were not picked or something happens, unfortunately, during pregnancy.